I might start with an apology. I know that members of the Afghan community might have felt singled out by statements I made recently. That was absolutely not my intention. So sorry. I have volunteered a couple of times to work in Afghanistan in 1997 and 2003. It's a country I love and respect, and its people. So, Mazarat Meham or Wabakhay, I apologise. In terms of numbers today, it's fantastic to have case numbers lower than the temperature in Victoria. It's the first time in a very long time. So we are absolutely trending in the right direction. That's reflected in all of those numbers. Active cases in health and aged care workers, active cases in the community, and numbers in ICU and in hospital. So all very positive trends in that regard. I know that as we get to very low case numbers, there's a not unreasonable focus on individual clusters, individual outbreaks. It's not to say that they're backward steps. We have said many times that we expect it and that they will happen. They have probably happened at the same rate right through this epidemic peak, but we haven't seen them in the 700 a day. We haven't known the clusters that have been occurring right through the really significant time through this second wave, but they've probably been happening in much the same way right through this second wave. But we get on top of them, and the absence of new cases in Casey in the last couple of days is an indication that those pillars of public health response, isolation of cases, quarantine of close contacts, testing broadly, are absolutely the keys to stopping them. So if people feel that it's a threat, they get anxious, or they feel like it's a really significant backward step, I would say we should expect them, they will occur, but we know exactly how to respond to them. And when we've got such small numbers, we can absolutely give our focus and attention with the incident management teams that we set up, with the very significant engagement that occurs, and with the very agile response of the testing teams for pop-up testing on top of the very broad testing that we have in place at the moment.